Here are the two types of urinary incontinence that men may experience after prostate cancer treatment. So the most common form of incontinence after any type of prostate cancer therapy, especially after surgery, potentially would be stress incontinence or the leakage of urine when someone is doing some sort of heavy activity or exertion. In most cases, the best description that I get from some of my patients are they'll leak a little bit of urine when they're coughing or sneezing, or they're hitting a golf ball as they're coming through on their swing. In most cases, that is a form of incontinence that in itself will resolve over anywhere from a month to 6 months, and sometimes even up to a year. And it does require a patient to also actively help to resolve that situation by performing Kegel or pelvic floor exercises to strengthen the sphincter within their around their urethra. And that is something that they need to do on a diligent basis in order to really basically recuperate some of that bladder control. The other form of incontinence that people can experience is something called urge incontinence. And urge incontinence basically is defined when urine is leaking through when a person feels the sensation that they have to urinate, but they cannot hold that urine back. That tends to be a little bit less common in most cases as far as associated with surgical removal of the prostate, but it can be definitely present when someone has some form of radiation therapy and also with cryotherapy. And in those instances, what's happening there is the prostate itself, after any of these type of therapy, is shrinking and decreasing in size. And so with the change in the shape of the prostate, it sort of pulls or tugs on the bladder itself and causing some localized irritation. And sometimes also that can occur with the radiation itself. It can directly irritate those areas well. In those instances, those patients are usually managed with medications. Medications that basically tend to decrease the sense of urge. There are basically two classes of these medications. One class is called anticholinergics, which basically will tend to potentially cause some dry mouth when people take these type of medication and constipation. And then now, more recently, there's a class called beta-3 therapies. And what that type of medication does, it works in a different mechanism, but they also help to decrease the sense of urgency, help patients able to hold their urine more, and therefore reduces the chance of the urge incontinence. Usually the treatment primarily is dealing with medication.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.